Hi, I'm David Klein. I'm an orthopedic surgeon at Kennedy White Orthopaedics in Sarasota, Florida. I wanted to talk to you in this orthopedic moment about trigger finger, a type of tendinitis that's very common and causes snapping of the digits. Many times when people get trigger finger, it starts on its own, sometimes in the early morning. What people notice is that when they try to make a fist, their fingers often go down, but when they extend their fingers, one hangs up and then tends to snap out again. It's not a form of arthritis, it's a tendon problem. The tendons are the connections between the muscles, which for moving the fingers are up in the forearm, and the bones of the fingers themselves. So tendons are long cords, almost like a shoelace, that connects the muscle to the bone. These tendons are held in place in the fingers by a sheath with pulleys that go around the bones so that when you bend your fingers, the tendons are held very close in approximation to the bones. In a condition of trigger finger, there's a swelling that occurs in the tendon between two of those bands. It's often called a nodule. In normal cases, if you figure that an analogy would be a shoelace through a shoe, the tendon should slide easily back and forth through the eye of the shoe. However, if you get a nodule, such as in trigger finger, it's almost like having a knot in the shoelace. And to get the shoelace through the eye of the shoe, you have to pull hard and even get to deform the knot so that the knot passes back and forth through the eye of the shoe. Sometimes it takes quite a lot of force to do so. In some cases, when this is quite severe, the finger won't even fully bend or won't fully extend anymore. Treatment for trigger fingers can be done either to reduce the size of the swelling in the tendon or to open up the size of the sheath that the tendon has to fit through. For the former case, where you're trying to make the nodule smaller, a cortisone injection to the tendon sheath is helpful to get rid of the condition in about 6 of 10 people, and maybe for about another 1 of 10 people for a second injection. If you don't get a cure for your trigger finger with cortisone injections, then surgery, a small surgery under local anesthesia, is usually the best way to open up the sheath so that the tendon with its nodule will pass back and forth. Recovery sometimes takes a few months to feel better, but you should be moving quite well right after the surgery, and if the injection of cortisone works, within a few weeks after the injection.